So I was asked to start my pitch with a 30-second elevator pitch to give an overview of my company. But instead, I thought I'd start by addressing the elephant in the room. At the Lowdown, we are not at the cutting edge of neuroscience or frontier of robotics. We don't use AI or machine learning. And most importantly, we don't talk about patients, treatments, or pathways. No, we don't talk about patients. And that's for two reasons. Firstly, women's reproductive health is so badly underserved and far behind many other areas of science and research that many of us haven't even begun to use the most advanced methods we have available to us to solve it. And secondly, there's a whole part of the existing healthcare system that is geared towards women's reproductive health, parts like contraception. But the problem is, women are not ill. They are not patients. And the problems we have are being treated in the wrong way. At the Lowdown, we are redefining what healthcare means and learning that feeling listened to and understood is the healthcare that many of us are looking for. I'm here because when I was 16, I started taking the contraceptive pill. And this is how it made me feel. It completely changed my personality. It made me feel depressed and emotional. It impacted my relationships and my ability to do my job. And over the next 10 years, I went on a contraceptive journey to try and find the right method for me. And I realized that I'm one of millions of women who are overwhelmed with choice, experience devastating side effects from being on the wrong method, and can't get access to the expert advice that we really, really need. There are 20 million Google searches in the UK alone every month for women's health. Women like me are desperate for information, but the internet just doesn't help us as much as it could. Like many women, I ended up on Mumsnet forums, trawling through posts from Ouija Mum, trying to understand what DD2 or DDH means. Or I went to my local sexual health clinic and waited in a waiting room for 4 hours before receiving a leaflet about my contraceptive choices that was written in 1988. Going to see my GP, I was frustrated that I didn't have the time to get the answers to my questions, and most importantly, that the data and clinical research we both have available to us, me and my GP, just didn't exist. And a part of this, I think, stems from the fact that contraception is ironically a very unsexy part of science and research. Pharmaceutical companies normally funnel about 10% of their profits or revenue from a drug back into research and development. But in the contraceptive space, they only funnel about 2%. So in 2018, I had an idea. And that was really based on the fact that looking around me, women, all of my friends were talking about their contraception a lot. So I decided to build a contraception review platform, a place where anyone can share their experience with any contraceptive method and brand. Today, the Lowdown is visited by over 2 million women every year. We've collected a completely unique data set of over 200,000 data points on women's lived experiences with over 100 methods and brands of contraception. And we're closer to women's lived experience of this product or area than any other startup in the world. For the first time, women are able to access tangible data that gives them detail on things like their mood, their sex drive, their periods, the things that women really care about in this space. And our community love reading both the qualitative experiences and the quantitative data that we've collected. It helps them feel informed and in control. Most women only have 8 minutes in a consultation to decide which contraception is best for them. So we built a personalised contraception recommender tool that recommends, based on your preferences and your medical history, which might be the right thing for you. Over 50 million women around the world have missed or forgotten to take their contraceptive pill on time in the last month. And currently, they have to use this leaflet to work out what to do next. Yes. So we built a missed pill calculator that takes all of the latest medical guidance and basically works it out for you. And you can see at the end, it's either a code green, a code amber, or a code red. A code red is not good news. Finally, 1 in 3 women in the UK can't get hold of contraception from where they want to, thanks to the fact that the UK has closed 26% of its contraceptive services in the last 3 years. So last summer, the Lowdown launched the UK's first contraceptive subscription service. Thousands of women subscribed to get their pill, patch, ring or injection delivered every 3, 6 or 12 months. And the feedback we're getting on how much easier we're making this for women is astonishing. How will the Lowdown change the world? Well, I think we've already started to. Over 70% of our users come from outside the UK. And I guess what we've learned is that contraception is this tremendous gateway. Women use contraception for over 30 years in their life. It's the vehicle through which we really understand and explore so many other areas of our reproductive health. Next up, we're using our community-led approach to tackle the next stage in our reproductive life cycle. All of these areas have the same set of problems: a system that isn't built without our needs in mind, a lack of data and clinical research, and an internet that's filled with misinformation. And most importantly, women who want to be in control of their healthcare decisions through the power of shared lived experience. Community-led healthcare has the power, potential, and scalability to truly change the lives of billions of women. I'm Alice Pelton, founder and CEO of The Lowdown. My WhatsApp's there if you'd like to chat to me about what we're doing. And finally, I'd just like to say thank you to the Wired team for giving us the best bit of press coverage we've ever had. My mum was really proud. And looking forward to taking your questions.